Hey everyone, so welcome to week 2. Can't believe we're already here. This week we're going to be talking about the helping and collaborative relationship that we develop with our clients throughout time. So what exactly does the collaborative approach mean? It means effective teamwork, professional cooperation, the enhancement of existing collaborative relationships, such as worker to client relationship, worker to colleague, worker to agency, worker to community. So first I wanted to discuss the generalist social work practice with individuals. So during our initial assessment with our clients, we're working through exactly what it is that brought them in. We're figuring out a target area that we can analyze with them to further help them in treatment. So the biggest thing that you're going to be working with in your initial assessment phase is the person and environment theory. So understanding that, clients that are going to be coming in, obviously in their own environment and how it affects them. So you're going to be dealing with a lot of clients who are in current abuse or had past abuse, are in current drug addiction or had past drug addiction, or family members who had drug addiction. You're also going to be dealing with maybe some juvenile or adults who are gang affiliated or who have family that are involved in gangs. You're going to be dealing with a lot of homelessness as well. So really understanding how the environment shapes that person is really what helps them come back to you, because they feel like you understand. You're not judging them for their current circumstance. You're not telling them what they could or couldn't have done better. You're really assisting them through the treatment process, and that's what helps develop that collaborative relationship. So understanding demographics and understanding ethnicity and culture is a huge part of the helping relationship, because a lot of our patients, obviously come from different cultures and ethnicities than we do, and understanding that is key. So for example, a lot of you may be younger than a lot of the clients that you encounter out there in the field. And, I always find it's the best practice to initiate that conversation right then and there, so you really know if you're going to be able to really help this patient in their treatment. Identify, I'm a younger social worker, and, I would really like to help you through this treatment, but if you're uncomfortable, please feel free to let me know. I think you need to address that head on, because if you don't address that and they feel uncomfortable about it, they will never truly be open with you about what's going on. And that's really key, like I said, to helping them, is for them to understand you and you to understand them, so that if they're uncomfortable, either A, you can work through that with them, or B, maybe you're just not the right clinician for them. And that's okay, because we aren't the right clinicians for every single client that we encounter. Another thing that is huge is race. And a lot of clients feel that if their therapist is not on the same socioeconomic playing field as they are, or don't really understand the hardship that they went through, that can be a big disadvantage to the therapist before even talking about anything else that's going on in the client's life currently. So really understanding that factor, and realizing that that may be a barrier you're going to have to overcome early on, but willing to address that head on as well. So some skills throughout the practice that you're going to be doing with clients, for example, just to name a few, are open-ended questions, which is which is key when you're therapeutically engaged with a patient. For example, if I just say, how are you doing today? That's going to give me a response or good or bad. It's not really going to lead me into anything. If I state, how do you feel about your coworker, blah, blah, who's been giving you a hard time, that right there can open the door to what's going on. Or, did you talk to your wife about what we discussed last week? So something like that is going to elicit more of an open response, and you're going to be really getting more from them than just a one-worded answer. Some other things that you're going to be using are minimal prompts. So minimal prompts are everything. So right here with the facial expression, if I have a face like this, I'm not really going to want to answer to that social worker, or if I have my arms crossed like this and I'm really tight. So you guys have to be very mindful of your body language in your face, because you don't understand how much clients will read you. They'll read you from the moment that they walk in about how open you are to listening to their story. And if you have an angry look on your face, or you're closed off with your body, then right there, they're going to be getting that sense of a closed response from you. So minimal prompts are really good in saying when they're speaking, your head nodding, you have your, maybe you use your hand, or, I hear that, so things like that are minimal prompts, and they're really good skills to be using. Also exploring silence. There's going to be a lot of times when your clients, say something and then it's just silent for a minute. And that's okay. Some therapists find that, silence is awkward. Sometimes silence is really good because it allows them time to process. Everyone can't process at the same speed. So if they've just said something powerful, or both of you together with your collaborative relationship have found something profound in his or her treatment, you can let that silence be. And that's okay, because in a minute, if the client doesn't respond, it'll give you the option to say, how did you feel about that? And they'll come back with exactly how they feel because they've had time to process it. Another thing is reframing, so that they understand that you know what they're talking about, which is pretty key, because a lot of clients, when they're speaking with you, sometimes they don't know if you really understand how they feel. And by you reframing exactly what they've said and communicating it back to them, shows them that you are listening, that you do care, and you do want to help. And that helps build that collaborative relationship that we've been continuing to talk about. So in between hearing the messages that clients give you and listening to their words, a lot of times they will not think that they're being as open with you, but they really are. So really reading between the lines of what they're saying to be able to connect the dots is key. And a lot of clients will give you that, and they won't know that they're giving you that. So you have to really listen hard to figure out exactly where they are. And how they perceive their problem, because every client perceives their problem differently. So understanding how they perceive their problem, because their problem to them may be a catastrophe in their eyes, when another client who has the same exact problem, it's, on a rating scale is a 2 for them, because it's not that big of a deal. So you really have to understand how the client perceives their problem and really be able to work with them from there. So one thing that can also help you better understand your patient is the eco map, which would then allow you to really understand exactly where the patient is coming from and everything around it. So I made a little eco map for a fake patient. So if you could see here, basically this is John's eco map. So all of these relationships here for John basically are either positive, negative, strong, or weak. So the solid line indicates a strong relationship, and the dotted line indicates a weak relationship. So this will really help you better understand your patients. And what I always say is, during one of your first sessions with your patient, you can actually do an eco map together, so that maybe the patient themselves can actually understand and see in their mind who in their environment is actually good for them and who is bad for them, which would lead you to better understand who they are and what you can really work at. So another thing I wanted to talk about is setting realistic goals with patients, because as we talked about in week 1, some patients have the idea that going to therapy is going to solve every single problem in their book, and you guys are going to be the miracle workers that are going to help guide them through everything that they ever encounter, which, as we know, is not true. So setting goals together at the beginning stages of your helping relationship with them is what will actually help them attach to you and help you guys grow together, so that they feel comfortable enough to know what exactly it is that you're going to work on, so that their expectations are already set. That they're not believing that, in 5 weeks, they're no longer going to have urges to use drugs anymore. Because as we know, that's not true. So understanding, setting a goal of maybe attaining 3 coping skills to help with my urges to use drugs in the next 5 weeks, that's something that's attainable. So understanding how to really word that and work with clients to set that goal is really key. So some interventions that you are going to be working with are such things as supportive counseling. So supportive counseling was set in place to assist clients in resolving concerns and challenges to enhance coping and improving functionality. The supportive counseling role is really there to be a supportive person for that patient, helping them resolve things and the challenges that they occur. Another type of therapy that you'll encounter is problem-solving therapy, which is often referred to as like a CBT type of thing, which helps the client to identify effective coping strategies to deal with everyday problems that they have in their life. Instead of just the supportive therapy where there's one challenge that they're trying to overcome, the problem solving therapy is helping them overcome daily life problems that they occur with every single day. So that's the difference. There's also education type of therapy, which you really will often do by itself. It almost becomes an intervention, as you're working with the family or the group or the client to educate them a little bit more about maybe what's going on in their own body, their own mind, and you help them grow with the concepts that you're giving them knowledge about. So that often becomes an intervention during your therapy. So one of the last things I want to talk about is termination. When the helping relationship comes to an end, it can be pretty difficult for some clients because, they've been with you for a long amount of time. They've expressed their feelings. They trust you. You've guided them through that process, that healing process for them. And, unfortunately, it's time for either them to move on or something else has happened. So termination can be extremely hard for a client. Planned endings are more easy to work with. So either at the beginning of your time with the client, you've established that, they're going to be here for 8 weeks. So it'll be a total of, 16 sessions or whatever you guys have agreed to. So you start that termination. I always say you want to start it about a month before you actually terminate, because it gives the client time to really process that, this helping relationship that I have is coming to an end. So it really helps them process through that. And you're really going to need to guide them through that, because for some clients, you are their only support system. So it's really hard for them to understand that it's coming to a close. Also, for a planned ending, some patients may feel that they're sufficient on their own at this point, that you've assisted them in getting all their skills that they need. They understand, how to communicate better or understand how to cope better. And at this point, they feel like they can be out on their own without your support. And, that's really positive within itself as well, that the patient has that type of self-awareness and understands themselves. There are also unplanned endings where you will encounter sometimes when social workers leave agencies, which happens very often. You're going to be getting a client of that social worker's, or if you're leaving, your client's going to be going to somebody else. So that's a really hard termination, because of the fact that if you're that social worker receiving that patient, that patient is used to that other social worker. So for them, they're looking at you like, I've already established my helping relationship. I don't really need to talk to you. I really want to talk to my other social worker, but that's not possible. So for clients like that, you're really going to need to start really at the beginning with them to start a fresh base for that helping relationship for them in order to continue. So really guiding them through and really helping remind them of all the skills that you've given them and that they've given themselves through this helping relationship and process, and helping them understand that they can make it out there, that they can do this, giving them a lot of encouragement and helping them understand, and going through all of the supports that they have will really help them through the termination process. So in closing, everyone, I just want to recap some of the important points. So collaboration in the helping relationship is absolutely essential to the social work practice, because if we cannot form a good base relationship with our clients, we're not really going to be able to assist them moving forward. So sometimes it's going to take at least 1 to 3 sessions in order to build that relationship. You may not start seeing progress until about 4 or 5, because of the fact that they've just established their helping relationship with you. They just understand you, you understand them, and they finally feel comfortable enough to go through, to express what they've been going through. Assessing our patient at where they're at is key, and also helping them understand that the goals that we're setting are going to be attainable. Like I said earlier, we're not going to be able to solve all of their world life problems, even though they may think that we are. So we need to be able to really focus on one identified problem that they would like to work on, and helping them establish how we can help them through that. So this week, guys, I really want you to think about your own systems and how it's made you who you are, because if you can't really understand who you aren't going to be able to really develop a collaborative helping relationship with other clients. So I would really like you to develop your own eco map. It does not have to be large. I'd like at least 5 different systems around you, whether it's your family, your church, your community, your neighbors. So please do that. You can either draw it and put the picture up to the discussion board, or you can type it. And if you guys are fancy with Excel and stuff like that, you can do that as well. If you have any questions, please feel free to let me know. All right, guys, have a good week.